we're going to demystify exactly what's happening inside the body when the lights suddenly go out. Okay, let's dive right in by defining our inciting incident, which in the medical world is known as syncope. In plain English, syncope just means the brain temporarily isn't getting enough blood flow or inadequate cerebral perfusion to keep the lights on. The person loses consciousness, their body goes completely limp, but crucially, and this is the key here, they make a complete and total recovery shortly after. And the sheer scale of this is exactly why we're digging into it today. Up to a quarter, think about that, 15 to 25% of all children and adolescents are going to experience at least one of these scary episodes before they hit adulthood. It's actually highly unusual in kids under 6, but in older kids and teens, it's incredibly common. And look, while it's usually totally benign, it can occasionally be the very first alarm bell for something much more life-threatening. So here is our case file for today's explainer. First, the anatomy of a faint. Second, the diagnostic detective work. Third, ruling out the heart. Fourth, brain versus blood pressure. And finally, number 5, the usual suspects. This is the exact algorithm doctors use to separate the harmless quirks from the real danger. Section 1. Anatomy of a faint, framing the scene. Let's look at the overarching blueprint of this medical investigation. The standard diagnostic flowchart for pediatric fainting is basically a doctor's literal treasure map. When a patient comes in after a spell, a physician mentally traces these exact lines to systematically hunt down the root cause. The process starts at the top with basic tests and branches out based purely on the clues. If the heart's wiring is abnormal, they go one way. If it's normal, they look at neurological signs or sudden blood pressure drops, all the way down to the most common, harmless causes at the very bottom. Moving on to part 2. The diagnostic detective work, gathering the evidence. Armed with that map, the very first thing the medical detective does is gather baseline facts. Virtually every single patient gets this foundational 3-step workup. First up is a deep dive into the story from witnesses. What was the environment like? Had they been standing for a long time? Second, almost every kid gets an ECG to check the heart's electrical intervals. They're specifically looking for abnormalities in the PR, QRS, and QT intervals. And third, orthostatic blood pressures. Basically, checking their vitals after they've been lying flat for 5 minutes and then checking them again right after they stand up. Which brings us to part 3, ruling out the heart, the high-stakes suspects. Before a doctor can even think about relaxing, they have to aggressively rule out the absolute most dangerous, life-threatening culprits hiding in the cardiovascular system. So this begs a really vital question for parents, coaches, athletes, everyone really. When do we actually hit the panic button? Because not all fainting is created equal, and there are specific signs that absolutely scream cardiac emergency. Well, here are your massive red flags. If a child faints mid-stride during exercise, and I don't mean passing out after a long, exhausting run in the heat, I mean dropping right in the middle of intense exertion, that is incredibly ominous. The same goes for fainting while lying down, or just dropping suddenly without any warning signs at all, like dizziness or nausea. And finally, family history is a huge clue. Doctors are always going to ask about any family history of sudden unexplained death, SIDS, congenital heart disease, or even congenital deafness, which weirdly enough is linked to certain heart arrhythmias. Any of these red flags, they demand an immediate evaluation by a cardiologist, no exceptions. If those red flags are actually present, doctors are primarily hunting for 2 things: inherited electrical glitches or structural plumbing blockages. Electrical issues would be things like Wolff-Parkinson-White syndrome, or literal extraconduction pathway causes a wildly fast heart rate, or long QT syndrome, which is a genetic ion channel abnormality that can trigger lethal rhythms. On the other hand, you have plumbing issues like hypertrophic cardiomyopathy, or HCM. This is where thickened heart muscle literally blocks blood from exiting the heart. And a fascinating little medical quirk here, the heart murmur caused by this specific blockage actually gets louder if the patient stands up from a squat or does a specific breathing technique called a Valsalva maneuver. All right, part 4, brain versus blood pressure, narrowing the field. If the heart's plumbing and wiring check out perfectly fine, we move further down our diagnostic map. And this is exactly where eyewitness accounts crack the case wide open. Parents very often fear that their child had a seizure, mostly because a totally normal, simple faint can sometimes include a few little muscle twitches. But a good medical detective knows the difference. A typical faint, the child goes limp, turns pale, and wakes up really quickly. A seizure, the posture becomes rigid, they might look flushed and warm, and will have a prolonged period of grogginess or a post-ictal phase afterward. Moving away from the brain and over to blood pressure issues, we have orthostatic hypotension. Look, when you stand up, your body's blood vessels are supposed to constrict to fight gravity and push the blood up to your brain. Sometimes these pipes just fail to constrict properly, the pressure drops, and down goes the patient. In young people, this usually isn't some complex nerve disorder. It's almost always caused by hypovolemia, meaning low fluid volume from dehydration or bleeding, or it's triggered by medications like diuretics or beta blockers. And unlike a normal faint, it usually happens without those typical warning symptoms. Which brings us to part 5, the usual suspects, unmasking the common culprits. We've finally reached the bottom of the flowchart, arriving at the most common, overwhelmingly benign reasons kids pass out. Okay, let's talk about the classic vasovagal faint. This is the absolute most common type of syncope in healthy teenagers, especially 15 to 19-year-olds. It's essentially a temporary communication breakdown between the nervous system and the cardiovascular system. It gets triggered by things like standing for way too long, being in a crowded hot room, fasting, or acute stressors, like, say, getting blood drawn. But the real key here is the body's warning system. It is heavily signaled by prodromal or pre-syncopal symptoms. The teen is going to feel nauseous, turn incredibly pale, and start sweating heavily right before they drop. Another fascinating culprit, and one that is particularly common in young women, is POTS. Now, unlike a simple drop in blood pressure, POTS is defined by the heart rate. When the patient stands up, their heart rate absolutely skyrockets. We're talking a jump of more than 30 beats per minute. This intense racing causes severe lightheadedness, nausea, and frequent near faints, and it's usually accompanied by chronic fatigue and a real intolerance to exercise. But wait, what about the really little ones? I mentioned earlier that fainting is actually super rare in kids under 6. Well, for the youngest toddlers, the most common cause of passing out is wild. They're called breath-holding spells. A sudden scare or a really upsetting tantrum can trigger a reflex where the child literally holds their breath on an exhale until they turn blue and just collapse. It is absolutely terrifying for a parent to watch, but medically speaking, it's a well-recognized, very brief, and totally benign behavioral reflex. We're going to wrap up our medical investigation today with this lingering thought. It's kind of wild to think that a complex, highly evolved biological machine can be temporarily shut down just by standing up too fast, seeing a needle, or throwing a toddler tantrum. But while fainting is this crazy masterpiece of complex physiological dominoes falling, understanding this diagnostic map gives us immense power. It allows doctors, and hopefully now you, to turn sheer panic into structured, informed action. Knowing exactly which red flags to look for means knowing when to act fast and when to simply let the patient rest, recover, and wait for the lights to turn back on. Thanks for joining me on this explainer, and remember to keep questioning